Okay, I think we're live now. Good afternoon, everyone, and welcome to today's online debate on obesity, what's tipping the balance. Before we get started, let me just say a few quick words of introduction. Today's actually quite a big day for Euractiv. It's the first time that we're hosting an online debate, and it's the first time that we're broadcasting it live on YouTube. So this means that anyone with an internet connection can now follow the debate live and uncut as it's happening as we speak. So let me say a big hello here to our YouTube viewers. We're very grateful in this regard of having received support from Coca-Cola Europe to organize this debate, and we would therefore like to acknowledge this today and thank Coca-Cola Europe for their support. So about the topic now, why are we talking today about obesity and the concept of energy balance? Essentially, energy balance is a relatively straightforward and an easy concept. You're trying to get a balance between how much energy you're getting in via food and drinks and how much energy you're getting out through exercise. Now, for many of us, this probably sounds like common sense. However, when we look at the policy discussions that are taking place on how to tackle obesity, it's a notion that can help put things into perspective. So obesity is now routinely referred to as a global pandemic, and it is no longer confined to the United States. Even in Europe, about half of the adult population is now estimated to be overweight. And together with obesity, of course, comes a whole range of chronic diseases, such as cardiovascular disease and diabetes, which can be fatal over time and weigh heavily on our social and healthcare system. So there is indeed a lot at stake here with obesity, which is why we're looking today at the issue and trying to figure out how the concept of energy balance can help bring this debate forward. So to our panelists now, we're happy to have with us a panel of very distinguished scientists and experts in the field of obesity. First among them is Professor James Hill from the Colorado Nutrition Obesity Research Center. Hopefully joining us soon would be Dr. João Breda from the World Health Organization. We'll see. I'm being told that he's just joined, so welcome to Professor Breda. Then we'll turn to Ian Woodward from the European Association for the Study of Obesity. Then on to Professor Pier Paolo De Feo from the Health Lifestyle Institute at the University of Perugia in Italy. And finally, we'll close with Dr. William Bird from Intelligent Health, which is a health IT company. Hello, everyone. Thanks for joining us. We'll start first by hearing a first series of quick statements from each one of you, about 2 minutes. Let me insist on trying to keep with your 2 minutes statements, and then we'll move on to address a series of questions, some of which have been addressed to us via a Facebook conversation page. So enough said from my part. Professor Hill, the floor is yours. You have 2 minutes.
Yes, so I'm very interested in helping reduce obesity. I think energy balance is the right framework. It's straightforward but not simple. It's energy in and out, but it's also metabolism. And the question here is, you can achieve energy balance at all different weights. Why are so many people achieving it at a obese weight? And how can we help people achieve it at a lower weight? Those are the questions. I'm a big believer in the small changes approach, and I'm also a big believer in public-private partnerships. So I will say up front, I work with a lot of companies, including several pharmaceutical companies, Coca-Cola, McDonald's, General Mills, Wrigley's, McCormick's, and Curves. I believe that we have to help the public sector, the private sector has to work with the public sector to help make changes on both sides of the energy balance equation. Basically, understanding energy balance will give us clues as to why we have a problem with obesity, and it will give us strategies for reducing obesity. Thank you.
Okay, thank you very much, Professor Hill. You even took much less than 2 minutes. I'm turning now to our next speaker, Dr. João Breda from the World Health Organization.
Hello, everyone. Good afternoon. really a pleasure to participate in this panel, and thank you very much for giving us the opportunity. I say, as the previous speaker, I mean, we're actually strong believers in energy balance, and it is in fact important to balance the consumption with the intake of energy. But we're also strong believers you know, the fact that you're focusing too much on the energy balance by itself may prevent us to have, let's say, a comprehensive understanding in terms of the whole picture. What I mean is, by using energy balance, we may run to the risk of focusing too much on the individual. We strongly believe, you know, the environmental dimension is of huge importance in terms of the issues of, you know, diet and physical related NCDs, and also of course, the challenges of obesity. So my statement goes very much in the direction, okay, about increasing energy expenditure, but also is very much about our energy intake, you know, in terms of balance according to the need. And what, I mean, the landscape in terms of food offer, the food landscape, nutrition landscape in most of the European countries, and also, of course, in America, is really goes a lot in the direction of having much energy, and too much energy is provided, you know, probably by many of the stakeholders that we think we also have to engage with. But there's still a long way and a lot of work to do. I mean, much progress still needs to be achieved in terms of on how, particularly, I would say, the food industry responds to this challenge.
Okay, thank you, Dr. Breda, for this short introduction. The connection is not perfect, and maybe try and speak closer to your microphone in the debate that's going to follow. Turning now to Erin Woodward from the European Association for the Study of Obesity.
Okay, thank you. Thank you to everyone for participating, and thank you for giving us the opportunity to participate as well. So I represent the European Association for the Study of Obesity, and for those who are not aware, we are a federation of 31 national obesity societies across Europe. So we represent practitioners and patients from countries ranging from Iceland all the way through to Georgia and Israel and most countries in between. And so our challenge is similar to that of our colleagues at WHO, where we have 31 different health systems, 31 different cultures, more or less, and we have to find ways of facilitating both research and management to help our both medical and patient colleagues across the continent. And yes, we don't necessarily have as a medical society have a formal position ourselves on energy balance, so we'll be listening to the debate carefully, but many of our individual countries and members do have their own particular opinions about energy balance, and the balance, of course, between focusing on energy intake versus energy expenditure. So, as I say, we represent this wide range of people across Europe, and so we're going to hopefully contribute to an interesting debate.
Okay, thank you, Erin, for this short introduction. I'm turning now to Professor Pierpaolo De Feo from the University of Perugia.
Hello, everybody. Let just me come back to what Dr. Joao Breda just said. I think if we want really to be effective in counteracting the pandemic increase in obesity, we should see the strategy as an environmental strategy. We are late we should try to enhance population physical activity levels, and it is really a big challenge that we cannot postpone. It's time to change. The experience of our Healthy Lifestyle Institute of the University of Perugia suggests that to be effective, a population health enhancing physical activity program must have two characteristics. One, should be structured as a community-based program. Two, should distinguish between different target population. I mean, different is the message for children, for adults, or for elderly people. For instance, our experience in the community-based program, the Eurobees is an acronym of the EPOD Umbria Region Obesity Intervention Study. It is a network that includes politicians, decision makers in the fields of industry, food distribution, working places, school, sports, tourism, health sector, and that involves volunteer executions. Only all together should be able to define actions that will remain and be viewed in our regional legislations. So Eurobees intervention is finalized to fight childhood obesity and overweight, and we use a communication strategy customized according to the needs of this age group.
Okay, thank you very much, Professor De Feo. We'll turn back to some of your suggestions later on. Your time has just elapsed. Let me turn now to the final speaker and introduction of the panelists. So this is William Bird from Intelligent Health. Please.
Hi, thanks very much indeed. And I'm calling from London here. So I'm a GP, I'm still a practicing doctor and been interested in physical activity aspect of the energy balance, but obviously that has the effect on obesity as well. So we've been working in my last 20 years, been trying to work getting doctors on board, getting the health service to understand how do you get more people active and the importance of physical activity on that side of the energy balance. But also increasingly interested in the work that's been going on for some years now by Stephen Blair, showing that actually the end point should not be purely weight, but the end point of what we're trying to do for the health outcomes should be activity itself. And so trying to get activity as a primary aim, because that has all the effects that we've been hearing on binding communities together, on trying to get people more active to walking to school, so the transport aspects, and actually activity itself generates a much more stable and much more vibrant community. So the activity is an area I've been working on and working with the Department of Health and Public Health England, where this has become much more serious now and is now taken as a priority for the UK. So what we're just doing in Intelligent Health is trying to get whole populations more active in the town and the city. So we're trying to get 15, perhaps 20,000 people more active by using the community energy in order to kind of get that coherence. So from the energy balance, yes, I'm very keen to reduce the obesity, but what we're using here is not so much the weight loss as the endpoint, but also the activity as an endpoint.
Okay, thank you very much, Dr. Bird, for this good introduction. Let me turn now to the actual debate that we're going to get started now. So I will ask one question, and each one of you will be offered a few moments to make a comment. You don't have to make a comment on each of the questions, but this is, given that we're in a video format, I think this will help a great deal in trying to structure this debate. So trying to answer today's question, which is what's tipping the balance on obesity, so energy in versus energy out, where is the emphasis being placed nowadays? Do you think, is there too much emphasis being placed on one side of the equation? Obviously, Dr. Hale, I guess you're saying both, right? Should be considered.
I think it has to be both, and I think the problem is not necessarily that too much is being placed, but the nutrition group is over here and the physical activity group is over here, and I think the two have to talk more. It has to be both. For example, if you have a sedentary population, I think it's very difficult to have any diet that's going to maintain optimum health and optimum weight. If you have a active population, you still need to have nutrition, which doesn't lead to excessive overeating and obesity. So my whole point on energy balance is it's a mistake to focus on just one or the other. You have to focus on both, but I do think it starts with physical activity. I'm not saying diet is important. Diet is critically important, but if the U.S. population is so sedentary, occupational activity has gone down 40%. With the sedentary population, it's very difficult to have any diet that maintains health. Once we get people more active, now we have a chance with nutrition to give them a diet which makes them healthy and makes more and more people achieve a healthy weight.
Okay, thank you. Turning to Dr. Breda, do you agree with this energy balance concept? Do you agree that both sides of the equation need to be looked at from an equal point of view, or is there too much emphasis being placed on one or the other?
I mean, of course, I couldn't agree more. It's very important that you act on both sides. I mean, we have more and more inactive population in European region. I mean, we see that increasing. On the other hand, we also have to realize that the energy is important because, simple example, have like a snack with 600 calories.
I'm sorry, we can't hear you really well, Dr. Breda. Can you speak closer to the microphone? Can you try speaking closer to the microphone?
Suggest is that you pass on to the next colleague, and then you can come back to me while I try to get the mic, okay?
Okay, thank you. Turning to Ian Woodward, what's your take on this debate, energy in versus energy out?
Oh, well, I think the point is very clear that it's of course sensible to address attention to both sides of the equation. It's not at all easy to let's say increase physical activity if you're morbidly obese. It's not necessarily easy to change behavior, but I think to be conscious of both sides of the equation is a sensible approach. But it's also, we also need, I think, in terms of clinical care, to be conscious of the amount of physical activity and the ability to undertake physical activity that is possible with certain types of patient. And we need to be also conscious that with some kinds of energy, and it takes a huge amount of energy out to balance there. So we need to be, we do need to be conscious of that. But I think the point that the nutrition side, the physical activity side, should really be working together in a more transdisciplinary approach with a multi-stakeholder approach is really a sensible way to think about it.
Okay, Professor De Feo, this is a bit in line with what you just told us before, right?
Yes, of course, both sides of the balance are crucial, but the message, the communication is also in function of the target population. For instance, let me make an example. If we ask to children overweight or obese, which strategy you would adopt to counteract your overweight? Would you reduce the food intake or would you increase your physical activity level? Well, most of them just answer, we would move and have fun. So it depends on the target population if you can increase the energy expenditure or if you should control the energy intake. Anyway, both sides are crucial to be successful.
Okay, turning to Dr. Bird now.
Thanks very much, and I totally agree with what's been said, and Dr. Hill particularly, that it's got to be both sides. Some of us are obviously more specialised in one side than the other, but actually we would probably go further upstream to actually creating a kind of more content society, a happier society. And if you have a happier society, then you're going to have a more active society, because you've got, when you're stressed and when you've got a dysfunctional society or community, you're going to have more likely to have inactivity. You're more likely to have bad food choices. You're more likely to have poor food outlets. And so improving the infrastructure and the community cohesion can actually deal with both sides at the same time, because you're creating this better society. And I think we need to look higher up, because what I feel sometimes can be done on obesity, particularly when the health service commissions certain bits of work, is it is an add-on. The physical activity is an add-on to people's lives, and that's not sustainable. Or the diet is a particular diet for 12 weeks, and that's not sustainable. So what we have to do is to build this deep inside that whole community feel, which is obviously what from Italy and Eurobis has been doing. And therefore you create both sides simultaneously, because that is how a society works.
And so you believe tackling both sides at the same time is absolutely crucial, or should both sides of the equation be tackled also separately? I mean, this is very much what's been the focus at the policymaking level in Europe, at least.
No, I feel they should be done simultaneously, because they're part of changing society. You can't, if they're done one after the other, they're add-ons. And like brushing your teeth, suddenly you add it onto someone's life. That's not how it should be. It should be deep in someone's own life and through a community.
Professor De Feo, this is very much what you were saying too, or do you have something a little bit different to add?
No, I totally agree with William.
Ian Woodward?
Yeah, I would agree that that's something that's very important. What I would suggest is that it might be a challenging. It's very nice to think about it like that, but is it really possible across a whole European continent, where there are huge differences in demographics and in the amount of, let's say, attention that obesity gets from policymakers across different countries in Europe? That's one of the challenges that we see happening. That in the UK, we're of course, let's say, a little more advanced in thinking about these things, but in other parts of the continent, it's very difficult to even have obesity recognized as a problem. So many of the countries don't even have a policy on obesity. So I think if we can try to encourage this integrated approach that you describe across the continent, it would be very beneficial.
Professor Breda, if the connection allows and is slightly better, so tackling both sides of the equation at the same time, is it something that you think is desirable, or should we target specific elements on each side of the equation, like has tended to be the case so far?
Hope you can hear me better now. We definitely believe that you need to act on both sides of the equation. Also need to be very careful, because we need certainly extreme measures, and we need actually measures that have impact levels of obesity in Europe. We need to avoid that the balance argument is used somehow avoid the implementation of measures that are more, say, necessary at the population level. We need to have population level initiatives. If you wanna really actually to work on repopulation.
Dr. Breda, I'm not sure we can really hear you still. I'm having lots of trouble hearing you. The connection seems to be extremely bad. I don't know if this is shared by the others, but...
Yes, I can't hear him either.
Yeah. Maybe try and do something about your connection here, because the connection is really too bad. Let me turn now to the first remark that we've had via Twitter, and that was, in fact, in the run-up to the debate. Somebody who calls himself Ketchup on Twitter, quite funny username, proposed an answer to today's question on what's tipping the balance on obesity, and this user replied, food. So clearly focusing on one side of things. Maybe we'll do a first round on this, and maybe combining with another remark we just had from Ludivine Felix in Brussels, which says, and it's about it's more or less the same thing. She says, what about the role of SSBs in obesity? SSBs meaning sugar-sweetened beverages. So food and beverages, Dr. Hill, maybe you have a go at this one.
Yes, I think oftentimes when you first take a look at the obesity epidemic, it looks like it's food. In fact, what I think is human physiology works best when we're very active and we eat enough to match our level of energy expenditure. I think what has happened, because we've changed the environment and we've basically engineered physical activity out of our lives, we're so sedentary that it looks like food's driving the equation. We know, for example, when you quit moving, your metabolism is negatively affected. You become metabolically inflexible, which means you can't use food very well. So if you look at the U.S. situation, where most of the population is sedentary, it very much looks like food is the problem. And you say, well, you can eat 500 calories in 5 minutes. It takes a long time to burn it off. That isn't the reason physical activity is important. That's one thing. Physical activity sets your metabolism working the way it's supposed to work. It enhances your appetite control. So I believe that we have to do both. That's all the reason we have to do both. And it's easy to look at one food, sugar-sweetened beverages or fast food or this or that. In fact, the problem is if you take metabolic inflexibility on a low level of energy expenditure, it's easy to overeat. We overeat those things we like, and when we overeat them, we store them as fat, we become obese, and we reach energy balance at an obese state rather than a lean state.
Okay, Dr. Breder, I hope the connection is back with you. But your take on the food and beverages side of the equation.
It's better.
What I wanted to say is that this argument that the energy balance quite often prevents us from thinking about the whole picture and kind of, thinking about measures at the population level have a bigger impact. Also used quite often by some of the stakeholders have responsibility in the issue of obesity, the necessary measures. Can we hear the stakeholders saying, oh, it's all about, consuming more energy than, it's the individual activity. We really need measures that actually affect the ability of food. We need measures that promote physical activity by creating environments where people can use active methods to get to work or more active methods when they go on their and so on and so forth. So we need to make sure at the individual level people need more energy.
Okay, thanks, Dr. Breder. I think we'll have to turn to the next speaker. The connection is still relatively bad. Ian Woodward, is food and beverages the culprit here?
Well, I would say it's certainly part of the culprit. It's not necessarily the entire fault of food and beverages, because you're looking at a situation where it's an unhealthy lifestyle. Consumption of SSBs, of course, is a big part of the intake of calories, and it's something that can be addressed and should be addressed. The amount of calories consumed via that route is certainly very high in certain populations, in certain countries, in certain settings, and it's something that that we as a community ought to address for sure. The availability of certain types of foods and beverages is there. It's been there for a while, and it makes it easier, I guess, for people to make poor choices. But also, I think you have to think about the physical activity side as well, as Dr. Hill has mentioned, because it being physically active, being physically fit, if you like, will help you make better choices. But I think we, as a community, have to be conscious of the need to facilitate people to make those choices. So I think if we create an environment where they have an access to a healthier lifestyle, be that a greater access to activity, a reduced access to unhealthy foods, then I think that's obviously going to be part of the solution.
Okay, Professor De Feo, on the beverages and food.
Well, the pathogenesis of obesity and overweight is multifactorial. So we should consider the intake as well as we just had before, the energy expended. People generally, when we talk about obesity, focuses their attention on the diet, and they forget that most of them are really sedentary. The recent data of the Eurobarometer are clear. And for instance, in Italy, we are like in the United States, about 60% of people does not practice any regular exercise, any physical activity. So I think we should focus primarily on increasing the energy expenditures to the physiological levels that our DNA has written in our genome. So first, increase physical activity level. Then it is also possible to have some, let's say, junk food, but occasionally. Most of the food should be healthy food. We have a lot of data about the healthy benefits of the Mediterranean diet, but I think it would not be popular, it would not be of success to promote banning of some food, because I don't think this is the key. The key is, as told Joao Breda before, an environmental action, an action on 360 degrees.
Okay, turning to William Bird now on the food and beverages industry's role into this equation. What is your take, Dr. Bird?
Yeah, I mean, I think from looking at certain of the kind of figures that a lot of the calories have remained fairly constant over the years, and in fact, sugar levels, I understand, and Professor Hill may may kind of help me here, but I feel that they've been fairly stable, and yet obesity has continued to go up. Of course, if you have too many calories in, if you have too many sweetened beverages, if you have too much fat and sugar, you will put on weight if you're not burning it off. So there's no question that that will be the contribution. But the question is why are we not burning it off? And we've talked about that on the physical activity. But also, why are people's appetite changed to the point where they're overeating, and why they are taking on too much sugar and fat? And we know that is because of a lot of complexity in both our makeup of our psychological makeup and the physiological makeup, of which physical activity is part of that appetite control. So I think, yes, there's a responsibility that the beverage companies and the food companies have to have about how they promote it and who they're promoting it to. But in the end, I don't think you can put the blame there, because actually obesity has gone up, even though the number of calories and some of the sugar has remained pretty stable over the last 10 to 20 years. And I would just be happy if perhaps one of the others, and Professor Hill particularly, could just qualify with that.
Okay. Dr. Hill, then, go ahead.
Yeah, first of all, I just have to say, in all disclosure, I just published a paper with a number of other people saying that I think self-reported food intake is absolutely absurd to use in any form or fashion, and I don't think it has anything to do with what people are actually eating. But what happened is the sugar levels, at least in the U.S., rose for a while, and now they're going back down a little bit. So it's true that it's bounced around a little bit, but the other thing that's happened is we've added sugar on top of a high-fat diet, and people don't realize fat has 9 calories per gram, sugar 4 calories per gram. You're going to gain weight when you overeat any of these. So sugar for a while, at least from some self-reports, went up. Sugar-sweetened beverages are going down in the U.S. That's the major source of sugar, but there's still, there's still a fair amount of sugar in the population.
Okay, turning to the energy out side of things, we heard very much that the solutions were best implemented at community level, so very much locally. How can policymakers really encourage this? Is it in schools primarily, and what can they do? Start with you, Dr. Hill.
I think our biggest challenge is why people want to change in the first place. We're very good at talking about this environment we've created where there's a lot of good tasting food, it's convenient, it's inexpensive, it tastes really good, and we've engineered physical activity out of our lives. I think everybody on this panel would certainly accept that those environmental changes have facilitated obesity. The question is, why do people want to change? I don't see people here lining up to get rid of their big screen TVs and their computers and their cars and their drive-thrus. I think our biggest challenge is giving people a reason for why they want to change. And if I were going to start in two places, I would start in schools, which is the long-term strategy of teaching kids why this is important. And I would also start in work sites where we could essentially incorporate health and wellness into the work site in a way that we actually pay people to be healthy.
Okay, turning to Dr. Breda, maybe quickly on the energy out and how policymakers can encourage this. Is it? Do you agree that most of it should happen at the school level?
I hope you can hear me now.
Let's try again.
Curious, I mean, I would like to come back also to the issue of, sugary soft drinks. This one is actually very important because there are clearly, types of foods. In terms of marketing, there is a Warehouse Assembly resolution that actually points to some, needs to restrict marketing of certain foods to children, and certainly, the promotion of sugary soft drinks would be included in that aspect. It's a very important one. And on the other hand, it's obviously in Europe, these types of drinks are not going down; they're rather stable. But in some countries, we have a very significant increase. Increase is important, and it's accounting, for tons of calories in months for particularly in children. So they still have a role to play. Let's say that we wouldn't like to single out certain types of foods. Are certainly important. Foods that have a low nutritional value should be certainly included in the groups of foods to restrict, to consume in very special occasions, I would say.
Okay, I think it's still very bad, the connection here, but I think we mostly got your message, which was focusing on marketing and availability of some foods and beverages at school. Still trying to focus on the energy out aspect. Turning to Ian Woodward, does it really start at school, or is this where the big focus should be in your view, promoting physical exercise at school?
Well, I think that could be part of it, but I think something that was touched upon by one of the other speakers about individuals wanting to change, or I'm not so convinced that individuals A, know that they need to change, or B, they even want to change. Therefore, to put the onus on the individual is not necessarily the correct approach. I think schools is a good place, of course, to focus attention, but you might want to think about pre-pregnancy. There are a number of European research projects looking at pre-pregnancy and the importance of maternal obesity. So I think you can even go a step back, but I think it might also be something to consider, not to think about the individual taking responsibility for change, but to facilitate change at the population level, at the level of the European level, the government level, and also community levels. I think this is something that WHO are doing a lot of work on with their regulations, trying to get member states to collaborate to reduce the intake of sugar, of salt, to increase physical activity, for example, but really to try and do that as an approach to addressing NCDs. But I really think you need to think about it at the higher level, as was mentioned by the other speaker with his examples of what's happening in the UK for promoting physical activity.
Okay, Professor De Feo, your take on the promotion of physical activity in schools, maybe? Is that a big part of the response, Professor De Feo?
I think it's one part of the response. I think to give a global response, you should watch the problem with, say, community-based approach. If you make a community-based approach, you try to construct, to build a network. And in this network, you should include all people which can contribute to the battle against obesity. So we should include politicians, decision makers in the fields of industry, distribution, working places, school, of course, but also in the sports sector, in the tourism sector, in the health sector, and involve also all volunteering associations. If you have a global approach, you may be more successful than only looking at a single sector as this important sector of school.
Dr. Bird, physical activity, of course, is your field of expertise. At the grassroots levels, targeting school children, is that one of the ways forward? Is that a big part of the answer?
Yeah, it is. I mean, certainly getting and the young children as well. You know, getting to the children aged 4, 5, and 6. You know, becoming active, making it part of normal life. But for every age group, physical activity has to be the natural choice. It has to be the kind of preferred option. So the other options of being inactive become more difficult. So it becomes more pleasurable to become active. And there are 7 best buys in physical activity, which have come from all the evidence. The first is schools, integrated physical activity. The second is transport, where we know that favouring walking and cycling has a major impact on the whole community. Urban design, to actually make sure that activity is a better option. Embedded in healthcare, so that all the long-term conditions of diabetes and for COPD and other conditions all have physical activity built into it, and the doctors and nurses are talking about physical activity. Public education, the mass media, raising the awareness, and then the community-wide programs that we've heard about, getting that whole community built in. And the final one, which is almost like the kind of spice you put onto a recipe to make it more edible, is the sport. You know, sport has a role. It's not the only role, but sport, if you embed it in a whole lot of physical activity programs, is the excitement, is the part that creates the local teams and get people watching. So if you put those 7 together, you will get a physical active society.
Okay, turning to the energy in, again, aspect of the equation, one key element there is consumer information. And information about the calorie content on foods and beverages. And Britain has been one of the pioneers, so to speak, here in Europe with its so-called traffic light system, which has got pros and cons. It's been criticized in some corners. Professor Hill, what's your take, seen from the United States, on the traffic light system? Is it something that consumers can easily grasp, in your view?
Well, we've been watching what's going on in Europe, and I think most of the experiments are happening in Europe, where the traffic light diet is more widespread. It's not so widespread over here. What we did try was menu labeling. So all of our restaurants, we've had menu labeling in the grocery store. All of our menus now have calories on the menu. And the results are starting to come in. And by and large, they basically find the people that were already pay attention to the menu labeling. Most people don't pay attention to it at all. And there's a small group of usually young men that look at how they can get the most calories for their dollar. So they're actually using it in an unintended way. So I think information is necessary, but it's far from sufficient. Just giving people information about what a good choice is, may help a little bit, but I think we've got to go beyond that. I think we've got to look at other ways to get them to make the right choice. I think we've got to look at the food industry to reformulate, to provide better choices. The problem is we like foods that contain sugar and fat, and so we have to use every strategy at our disposal, which includes education, potentially even price differences, and what I call stealth nutrition. It's how can we change some of these products gradually in small ways so that we suggested, for example, if we could reduce energy density of packaged foods, which could be done without the consumer even knowing it, it could potentially reduce food intake 25 to 50 calories a day. We have to use everything at our disposal, but information alone I don't think is going to be sufficient.
Ian Woodward, I've been told you need to leave in 10 minutes, so before you do, your take on the traffic light labeling system in the UK and consumer information in general. What's your take?
Well, we as a society, EASO, don't necessarily have a formal position on this particular issue, although a lot of our members across Europe do, and feel quite strongly that a clear labeling system and a traffic light or a wheel system works very well, because you don't need to be a mathematician to understand the content of it to know how to make a healthy choice. So we would, or certainly I would personally promote the use of a traffic light system, and I think what would help is a standardized system across Europe, which helps the consumer to make sensible, informed choices, but together with an educational package so that they understand why they might be making those choices. Information for consumers is, of course, very important. I don't think you can expect, and if you speak to a patient council or a patient advocate, they will probably agree with this. I don't think you can expect an individual to calculate figures on complex labeling, and I think therefore that a wheel system or the coloured traffic light system is something that works very well at the population level, and it's something that I think should be further promoted.
Okay, Dr. Breda, maybe very quickly, if the line is still bad, traffic light, no, you're saying no. Okay, let me turn to Professor De Feo, traffic light system and consumer information. What's your views on that?
Well, consumer information is very important, especially for some target population. I think about the economically disadvantaged people who are really need more education, because most people make some mistakes in nutrition because they do not know that they are doing mistakes. So the education is crucial, is important. And the other thing that is important is to facilitate the healthy choices. I mean, we are now testing in a pilot study together with the large food distribution this option to try to increase the consume of healthy food, so vegetables, fruit, fish, and so on. Together linking this increase in this healthy food with the increase in energy expenditure. So we will distribute some discounts to people who consume healthy food for making physical activity outside or in sports societies and other centers. So we are trying to connect the healthy habits, nutrition, and energy expenditure. We'll see what happens.
Dr. Bird, you're in the UK. You've seen this traffic light labeling scheme in place for a few years now. What's your views on that?
I mean, I'm not an expert on the nutrition side, but I do see patients every day. And I can certainly say that information on its own is not going to change most people's habits unless they really believe they want to change their habits. So particularly in some areas of the UK where obesity is so prevalent that it's at the norm, it's the complete norm, and therefore people don't believe that there should be any change for their children or for themselves. And therefore, that information won't be of much help because people aren't even going to attempt. So we have to get higher up to actually get a reason why people really want to make an effort into losing weight or increasing physical activity, and that's where it can start to help. Certainly, I think the traffic light has been, and I don't know the full evidence and the reviews of what's happened, but certainly I've got from patients that it does help. They know where they should be going for, what kind of foods. They'll pick up two ready meals, and one of them they'll put back and one of them they'll keep, particularly when it's for their children, where they start to see that's the first signs where people feel they should be working towards loss of weight of going for children. So I think it's part of the pattern and part of the armory we've got, but it is only a small part. But you have to get people to really want to make a change before it becomes useful.
Okay, turning to remarks now that have been sent on Twitter, we have somebody here, Vicky Pirogliani, saying and pointing out this Eurobarometer study saying 60% of Europeans do not exercise at all. Greeks are even worse, 70% do not do any physical activity at all. And then we have another Twitter user, Ludivine Felix, saying it's getting better. In fact, in 2009, the first reason to do sports is health. How to promote physical activity? For her, that's the question. How can we promote physical activity? James Hale, what's your views on that?
Well, I agree totally with everything Dr. Bird said about making it part of society. But let me tell you what really bothers me and worries me is that in the U.S., the decline just in occupational and household physical activity has been on the order of several hundred calories per day. How do we get people to do enough exercise to make that up? So I agree. It's the strategy. We've got to move forward, but we've engineered physical activity out of how we live our lives, and that's the part that's going to be difficult to fill that back up. At least in the U.S., recreational activity has been fairly constant over the years. Now, if you put up to a 40% decline in activity of daily living on top of that, it means we have to ramp up our physical activity so much. And I think it's going to be difficult to do that. This is an area where I desperately think we need some innovation and new thinking.
And your suggestions there, then, therefore?
To bring in smart people and let's figure out some new strategies. I wish I knew how to do that.
Okay, turning to you in Woodward on how to promote physical activity. If you're still with us, I see your microphone's being turned out. Microphone's turned off. Yeah. Yes. Okay.
I was just saying it's not my area of expertise. I would defer to better minds.
Okay, that's all right. Professor Breda, if we can hear you, no, you're still saying no. All right, I'll turn to Professor De Feo on how to promote physical activity.
Let me tell you, we cannot listen to Professor Breda, but he's just coordinating a working group for the WHO Europe to write an European strategic plan to promote physical activity. So we are working all together to find the potential strategies finalized to this aim. But I think the key is in the words of William Bird. The key is physical activity means better quality of life. So if people experience regular physical activity, people feel better. So if we link the concept of fun and quality of life to physical activity, people will think that it is convenient to make physical activity. I mean, personally, I do, and I will not quit, because for me it's fun. It's not a healthy choice, because it's fun, just fun.
Okay, finishing now with Dr. Bird on the promotion of physical activity. Your experience on that, your recommendations?
Yeah, I mean, I think just as Professor Hill said, we've engineered all this activity out of our lives. To engineer it back in again is a revolution. It has to be a major revolution, because we cannot work on small little schemes coming here and coming there and being added on, almost like kind of sticking plasters onto this major wound that we've got. We've got to engineer that with the way people live, the way they work. We should be sitting down like we are now. We should be standing up as we're doing this conference call. We should be having walking and cycling in every aspect of transport rather than just in cars. We have got to work completely. I'm glad to see Professor Hill standing up now.
Yes, I'm standing up.
Yeah, that's excellent. So we've got to have a revolution where everything is changed, and it's a fundamental change that's going to take place in society. And we can't do that individually. We can't do that with just individual teams. But that's the manner of the change that's required to actually get physical activity. And just to go back to Professor De Piero, it's got to be fun. It's got to be the choice that people want to make. If you get them to do something, physical activity is hard work. You know, it is work, and people don't like work. People like to actually rest. People like relaxing. But they will work if it's something which they enjoy. So if it's playing with the grandchildren in the park, that is something people will do. They won't call it physical activity. They'll call it enjoying themselves. If they walk to a game of baseball or football, that's enjoyable. So what we have to do is to create these scenes where physical activity is a secondary output to a better living and a better society. But it has to be a revolution. So
Dr. Bird, I think we'll take your words as concluding words, because I see it's 5 p.m. here in Brussels. I would like to thank all of you, the panelists, for joining us today for this online debate. I would like to thank Coca-Cola Europe again for hosting and promoting this debate. I hope the viewers who've been following us have enjoyed this webcast, this first that we're doing here at Euractiv. Let me conclude also by saying that we will have a shortened version of this debate that will be posted online on YouTube. There's a permanent link to the full debate that's going to be available right after we close, but a shorter version will be made available later on. Thanks again to everyone for joining us, and hope that we can continue this discussion, maybe physically one day, who knows, in Brussels.
Thank you.
Thank you.
Thanks, everyone. Bye-bye.
Bye-bye.